This is awesome. Rajiv, my last question to you is, what are still some of the problems that are unsolved that you're focused on right now? It's mostly for a call to the innovators out here who's listening in.
I think in healthcare in the US in particular, Ganesh, I think the fragmentation of the user experience is still a huge issue. So, for instance, an Elevance consumer that, let's say, accesses care and service capabilities via any of our digital assets or through one of our contact centers likely has a decent experience.
Yep.
But when that experience, goes from there to a hospital, perhaps they also have a great experience there. But then let's say you go to your primary care physician and perhaps you have a very long history with that primary care physician. The issue is that those three things exist in silos. We aren't able
Mhm.
to effectively control the connected dots across what should be a primary care visit, being referred to a specialist, perhaps a prescription being refilled, to having an administrative question about what's covered by my benefits, how should I use my HSA account, for example, to pay it or not. Uh, all of those things tend to get answered in silos, thus kind of creating this frustrating experience in the aggregate for our consumers, which while any one experience may be okay, the aggregate is always something that leaves much to be desired.
Mm.
And so I think the big challenge for us going forward in the next kind of 2 to 3 years is how do we simplify that experience so that the same delightful experience you have while shopping for things on Amazon, for example, could be then replicated in healthcare, where the multiple disparate experiences that comprise of the average experience can then have a common facade that's personalized,
Yeah.
delightful, and simple to use, and always surfaces and emphasizes the human to human interaction wherever possible. I don't think we've cracked the nut on that. And once that we break through that, I'm very optimistic that that can happen. Then imagine all the longitudinal insights we have about every interaction, how it then can improve the quality of care, reduce medical errors, make physicians more effective, reduce their burnout, and ultimately want to have consumers really engaged in their own health. Because today, people care about peripherally, or when there's an issue, of course, there's an acute focus, and I got to get better. But every other time when you're relatively well, you don't think about it. Like, so how do we make sure that there's ongoing engagement to keep people that are healthy, and then people that are either kind of transitioning into being chronically ill or acutely ill or have an issue, that we're able to anticipate those needs and then bring them back together. So exciting, sort of set of challenges ahead for sure, in being able to solve it with all of the constraints that we have in our industry, but one that I'm very optimistic that we can absolutely solve together.
Sure.